Hello, everyone. My name is Mark Hagayama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient slash survivor. Been dealing with cancer since 2021, early 2021, and I'm doing really, really well. Um, I'm expecting some more testing at the end of this month, so I will update everybody when I get those results. But everything's going really well. We're just coming off the Labor Day weekend, and I gave an update. I gave a bunch of updates in my last video, which was uh, called Updates Galore. And we talked about a lot of different things, so you can take a look at some of the things that are happening with me personally and in the cancer world as well. And with this video, I am so happy to welcome back Dr. Parul Dua Makkar, and she is a dentist, but she's had a direct experience with her brother in cancer, and so this is part two of our interview. And so what we'd like to do is talk about Dr. Parul's brother. His name is Manu, and his experience with cancer. He was also a dentist, and so we get into more detail about what happened with him, and then we will talk about the book that she wrote. And so, Dr. Parul, please reintroduce yourself and tell us a little bit about what's going on, and let's get into this.
Thank you so much for having me again today, Mark. It's really a pleasure talking to you, getting to know you, and for your continued support. And always well wishes for your cancer journey. So thank
Thank you
you.
so much.
Yeah. So I know we talked last time a lot about oral cancer, and that's what my brother had, and he was a dentist himself. And so he was going through, just for your listeners, during a lot of the treatment was during COVID. He was diagnosed right before COVID in 2019, and 2020, the cancer reappeared just when COVID hit. So we were in a lot of unprecedented times, and they were also people who, people were not allowed to be with him when he was doing the cancer journey. He had to go to hospital. My parents would drop him, pick him up. And I think during cancer treatment, a lot of support also comes psychological from getting support from your loved ones. And Manu did not have that opportunity because of the circumstances. And so he was not married, didn't have any children. So his outlet was writing. He didn't have any other form of outlet. He couldn't go out. It was a lot of, towards the end, it was winter and it's very cold in Calgary. And I flew down in December of 2020 when things looked pretty dismal. And we couldn't even have a conversation because he had so much fluid buildup in his lungs that was hard for him to carry a conversation. So sometimes he'd be one-line answers. And he would show me all these writings that he was doing, and he was making an online blog, and he said, I want this published. And I said, all right, just keep working on it. He was so hopeful to see it a reality. I told him in February, I found a publisher. Let's get this to writing. Let's get this going out into the world. And he's like, no, I got time. I'm going to write more. And I said, okay, keep writing, because there was nothing else going on. And unfortunately, he passed very quickly. And when I went to his house, and this is after his passing, I went to his house and everything was the same. You know, he had gone to the hospital on an emergency visit, and he had gone to just get checked out. We weren't going to think that this was it. This was the end. None of us were prepared for it mentally, or in any form of manner. You're never prepared for it mentally, but we weren't. He moved into hospice. He went into emergency. The next day he was in hospice. So we were expecting at least a few days, week. And the next day he passed. So when he did, I walked into his house and I found everything was the same. Like his books were where he was, his laptop where he was entering, his food was still there, empty vessels in the sink. everything was the same, but he wasn't there. It was his life interrupted. And that's where the title of the book comes from. And then I got onto his laptop and I found all these books, and he called it his survival guide. And that's why it's named that. And I just took his writings, the chronological order that he had written them in. And then I wrote the epilogue to the book, the aftermath, how Manu came to being Manu, how he became who he was, our life, how we lived together, apart in certain circumstances, and then what cancer did, how it affected us as a family, things lost, opportunities lost, a future promise that was taken away by no fault of ours. It's just the circumstance, you know. And
Just in our conversations, I could just feel how close you were to him. Even though you lived apart, you could feel the closeness that you had.
yeah, he was almost a decade younger than me. We had an 8-year gap. And so he was, he learned how to walk in front of me. He colored all over my books. I changed his diapers. And I saw him come into the world and leave the world. So I was almost a second mom to him, and when I look back to old videos, I look back to old photos, I'm feeding him because he's maybe 2, 3 years old, and I'm like, a 9, 10-year-old girl. So I'm helping him, walk, hold his hand. I'm picking him up. I'm feeding him, making sure he's taken care of. So all my life I took care of him. And and that was I think there's something called survivor's guilt. We all know of it. And that also plays a part because we have the same gene pool. Why him? Why not me? I got to live a life. I got to have married and kids. Manu did not have that opportunity. Life took that. He didn't get to travel as much because he was still building his career. Um, you know, what could I have done to save him? Why I wasn't living closer to him, that I could push for an earlier biopsy, push him for treatment, help him during the last stages. There were things out of my control. And so there's a lot of survivor's guilt. Yeah.
So you brought up a point that I'd like to ask. Do you have any idea why he got cancer and you didn't? Or you just, you know,
Luck of the draw. I don't know.
yeah.
His cancer was on the tongue. It was not HPV related, which is more on the posterior side of the mouth. One of the reasons, and he was, men are more susceptible to getting oral cancer than women.
Why is
Um,
that?
it is just and predominantly more in men than women. Um, and his risk factor was just that. He didn't smoke, social drinker, no vaping. And he said maybe there's a lot of radon gas in Canada there's a lot of houses that are torn down and rebuilt. And when the houses are torn down, there's a release of radon gas. And that's something to do with the higher altitude. Again, I have no studies. This is what he speculated. He had a 3% chance to get it. So whether it was environmental or genetics, because our uh, paternal grandmother also passed away of cancer, but it was pancreatic cancer. So is it genetics that we have, cells that can mutate? Uh, was it that, or was it environmental? I don't have answers to those questions, but why him? Why not me? I
Mhm.
don't know.
Right. I mean, it is a subject among, cancer patients and those related to cancer patients. That's a big question. Me personally, when I got cancer, I was always of the mindset, instead of saying why me, I was always of the mindset is, oh, I thought to myself, why not me? What makes me more special than somebody else, to avoid it. My sister, she passed away from cancer and she got cancer really bad. My brothers had prostate cancer, so it's
Wow.
something that's we've we grew up, our family had a plant nursery and they actually just closed after 88 years last June. And you know, associated with the nursery, as kids, we would play, inside. It was our playground. And there at that time, this is when I was small. I was like 4, 5, 6 years old. They were always openly spraying pesticides. And so back then, the pesticides were so much stronger than what's out now, and they lingered around.
Yeah.
So,
In the air, yeah.
we were sitting there playing in it. Plus, there's like a lot of high wires around the nursery, and and then we used to play in this dirt pile. And when the dump truck came to drop the load, we were always told, stay away because this thing was steaming. But out, looking back now, it was steaming with a very, very chemical smell, and
Yeah.
you could see it, the
Yeah.
steam. And
Yeah.
so that couldn't have been good either. So we
Yeah.
were, like all exposed, and that's why I think, you know, we, had great exposure, back when we were very young.
Right. When you're developing and your cells are young and they're, yeah.
Right. So, I mean, it, who knows for sure? That's just what we've come up with, but only God knows. So, but anyway, I'm sorry to interrupt you. I want to hear more about Manu's story.
Yeah. So I just felt this book was what I could do for him. I couldn't save him. I couldn't get him help during treatment, couldn't help my parents, um, couldn't help him with his practice. He sold it to another dentist. I couldn't take over that. There were so many things I couldn't do. But I was like, okay, the one thing that he asked me that I can actually do, I'll take care of it. And I wanted this book to be out in the world because, and I really honestly could have left it behind his laptop, but the writings are so beautiful. They're so filled with a lot of wisdom from not somebody who's 34-year-old, but somebody who's probably lived into, well into his full life. And I just couldn't let it sit around for no one to see. And he even talks about in the book that I found my soul, I found my peace. Whether somebody reads these words that I write or not, I really don't care. I found what I needed to find, his internal peace. He was very much in um he, he was very much in tune of what was happening to him. He had accepted his fate. He didn't fight over like, oh, why me? Why, like you said, why me? Right? He didn't have any of that thinking that this sucks, my life sucks, this is the worst thing, and then what luck of the draw I got. None of that. He had no anxiety, no depression, pure acceptance and pure love for the life that he lived. And he was grateful for that. And he talks about this out of body experience where he talks where his mind is away from his body and he's looking down on his body as his body's going through the cancer treatment because, and you know that as firsthand, the amount of pain and discomfort you're in, whether it's during cancer treatment or after, after the surgery or after the chemo or after the radiation. So he talks about this mind body experience, dissociating the two.
Did he, a lot of, I've talked to a lot of doctors and I've talked to other people about this, what we're going to talk about here. What I can't, I've been told that because of everything that I've gone through, that my pain tolerance threshold is like 50 times higher than the average person's. Um, I mean, but a lot of that is because of the way I've trained my mind to endure all these things. I mean, because let's face it, when you're going through cancer treatments and testing, particularly the testing, it's invasive. I mean, it's inhumane. A lot of the thing, I always wondered how in the world they figured out how to do what they do to another human being. It's just crazy to me. But I've been told by doctors, doctors that have treated me, and they're saying, doesn't that hurt? I said, no. But I know that, part of it is I've trained my mind in such a way that I don't let the pain, I acknowledge it's there, but I don't let it get to me. And so it just, at this point, it just doesn't faze me. I'm still dealing with lingering effects of, cancer treatments and things like that. But I'm not going to let it interrupt or disturb the way I live at this point. I've come so far. I was so debilitated that I could barely walk. I mean, so I can appreciate, seeing people with canes, with walkers, in wheelchairs, because I've been there. I know what that's like, and so I have tremendous compassion for people in that circumstance. Did he talk about anything like that in his writings?
He talks about a lot. He even talks about like how all the accolades in the world couldn't help him when he lay alone in a hospital bed, staring out the window, being shunned away from the world that he was no longer allowed to participate in. You know, he talks a lot about that. He talks about how he was just struggling to breathe, something that we take so for granted. You talk about mobility. He had a chessboard and he had to get drained. And if he didn't get drained, sometimes it was twice a day. He couldn't talk. He couldn't breathe properly. He had trouble, especially in the cold with the air. Um, he he does talk about his physical disabilities, but he also says, you know what, I wanted to give cancer. Cancer doesn't know what it's fighting, like I'm going to put on my fighting gloves for the third time. And it is a lot to do with the mindset, like you said, like there is a certain type of mindset you need to have. And I think adversity, any kind of adversity, brings you to that level. Whether it is cancer or some sort of physical ailment, maybe you had to have an amputation, or any other adversity, maybe a loss of job. With COVID, there's been so much adversities, loss of a practice, whatever it is. And I think when life presents you with adversities, you have to sink or swim, and you got to learn how to swim if you don't know, and you become resilient. And a lot of this, he was very resilient. I became resilient. It gave me a purpose to keep moving, because losing a sibling really strips you of your identity, like you lose your sense of, I have a younger sibling. I don't. I'm an only child now. Yes, I had a brother, it becomes, your vocabulary changes, your outlook changes when you think, you see, even if I see my husband's families get together, I'm like, I'll never have this. So, but that shouldn't take away from his happiness. It shouldn't take away from other people's. Like, I need to still be participating into the world. I cannot be sitting alone and depressed and say, oh, I don't have it. I don't need to come to celebrate something because you have it, or have the jealousy or whatever it is, or like, woe is me. Why me? but drive that resilience. Okay, this happened. I have to come to peace with it, whether it is your own diagnosis or loss, and be like, okay, I can try to create something good out of this. And that's what Manu said about mortality. He said not to fear mortality because we are all mortal beings. And we're all going to die at some point, whether it is cancer, or whether it's an illness, whether we go outside and get hit by a truck. Tomorrow is not really guaranteed to anyone, to be truly honest with you. And, just recently we had two hockey players that were very prominent NHL players from Calgary who were visiting New Jersey for their sister's wedding. They went bike riding and got hit by a car and both of them died on the spot. And these are fulfilling. So it's like life really isn't guaranteed to anyone. And Manu says, like, don't fear death, but give it the respect that it deserves. And to live your life doing good, so the soul of your work shall outlive you and your wildest imaginations. So that people, when you leave this world physically, when do people remember you? It's usually your loved ones who will remember you, right? Your kids, your grandkids. But then to receive that immortality, we still remember certain people for the work that they did, right? Maybe for an art they created, a movie that they made, a book that they wrote, something beautiful left in the world, something positive. And that was what his message. He's like, we're all going to die, and I've accepted my death, but I'm going to do something. And that's what he kept doing. He kept writing till the day he died. I want to leave something beautiful on the world to impart with it. That was his message.
So I'm sure you've read his blogs and his writings over a number of times, right? How did your understanding change from the first time you read it to just before you published the book, or did it?
I went through my own grieving process. There was a lot of anger. Initially, I had a ton of anger in me, and I think
Anger about what
losing
exactly?
money, losing
Okay.
money
Okay.
by him. That depression. There was a lot of anxiety. There was panic attacks. There was this sense of like a deep ache in the heart, like you can't explain it. Um, and not being inconsolable, like just not letting anybody through. So and then I kept reading, and it's written in first person. So when I read it, I feel like he's talking to me. And even though he was, 8 years younger than me, somewhere the roles reversed. Somewhere he became the older sibling. And when I read his words, what he talks about not letting failures define you, we've all failed in some aspects of our lives, but let it not be stumbling block, like it's not how many times you fell, it's how many times you got up. And I knew that he would not want me to live with depression and anxiety and panic attacks. He would want something better for me. He always did. He was always helping me with my practice. He helped me build my second practice because I had young kids at that time. He's like, you're not going to have time to find what materials and what color, what name you should pick, what things you should order. He would always constantly send, so I would have less work to do. We would talk about that. Was the one thing that united us, our work, because we were in different points in our lives for other things. And so that united us. And the irony of it is he died of oral cancer. And, it's something that's in our field. So I knew I could create something positive with this. And I know he would have wanted that. He wouldn't have wanted me. He was a fighter. And so these books they almost helped me heal because I didn't understand his pain. Just like somebody who is grieving and somebody who's never experienced death of a closed person, a close loved one, will not understand its magnitude. People say, oh yeah, we're sorry for your loss, and move on. Oh, you'll get over it. Time will heal you. No, it's just something you live with, and you have to just learn how to cope with it and learn to how to deal with it every single day. And I didn't get that concept until he passed. And then I'm like, I get you now. I understand what you were saying then. So I have one-sided conversations with him now. But it definitely made me, it changed my mental thinking and to truly live in the moment, doing the
That,
things you love.
that's awesome. That is so beautiful. It really is. I, I was just thinking real quickly about some of the most impactful interviews that I've done, and there's been quite a few. I think some of the most impactful videos I've done are not with the cancer patient themselves. It's been with close family members. One of the most impactful videos that I ever did was with Cara Honorado. Have you heard of her?
Mhm.
And she lost her 19-year-old daughter to cancer. And I mean, I just fought during that whole interview to keep from crying because it was just I was just so in tune and so invested. And I feel the same way here. I could feel, you know, the connection and the messages coming out like it's just it's so incredible to me, how uh, people are affected that are close to them, whereas, it's different when you talk to a cancer patient or a survivor and they say, yeah, I went through this, and you could feel it, but it's not the same. And it's actually harder, in my opinion, on the people around the cancer patient as opposed to the cancer patient themselves, because the cancer patient themselves, they're going through it, they have more control, whereas the family members or the friends, they're helpless pretty much. And I'm sure you felt the same way,
Helpless just watching from the sidelines. And for
right?
me, watching on video calls
Right.
because I couldn't be there. I physically couldn't be there due to the PCR and the vaccine, and he was immunocompromised. My parents didn't want me around. They're like, you're going to travel, you're going to sit on a plane. What if, he's immunocompromised? What if you give him something? He's already got, fluid buildup in his lungs. He cannot risk an infection, COVID of all things. So it was just very unprecedented times, and nobody had answers. No, there was no right or wrong. We were just kind of living day to day, and it was helpless, like completely helpless. But and
So
even his passing was very helpless.
So we're getting ready to wrap up here. I mean, it, I really appreciate you sharing all of this and so openly and
Yeah,
and I hope everybody, if you want to talk about the book a little bit more, where people can get it, things like that, and then I have one final question for you.
sure. And I think that's what Manu taught me about, being open, being authentic. Uh, I think culturally, as Indians that we would always want to put up the best. You dress the best, you talk the best, you show all your trophies, but you never show your scars. And Manu was so open about it, and that's what I learned to be open, and that's got me more authentic relationships. But yes, the book, Life Interrupted, Dr. Dua's Survival Guide. It's on Amazon. You can get it at Walmart, at Barnes and Noble, anywhere, any bookstore. But it's also on my website, and definitely, yeah, Amazon's the best way. It's in Kindle and physically.
That is great. So my final question for you is this, and
Mhm.
I can tell you. Um, what would you like to share about Manu's greatest message to the world, what would it be?
I think it is being authentic. He even wrote about, and he wrote this in his book, how he had a discontent with dentistry, how he felt like he was putting on a mask every day. He actually wrote an article that got published the month he died. Like literally, he showed it to me, it was going to get published, and it got published in the Dental Town magazine, which is a local magazine. And I found it when I went for his funeral. And he would say about how he was putting on a mask every day, but he wasn't what he, there was some dissatisfaction with the field. And with cancer, he had found his calling, which was writing. He was an excellent writer, very articulate. And he wished he had done that to begin with and not realized on society pressures you have to be a doctor per se. And so, living your true authentic self, doing the things that make you joy, being with people who make you feel happy, learning to say no to things that don't bring you joy. And that was his message. He's like, live because tomorrow is not promised and be true to it.
That's phenomenal. Absolutely phenomenal.
Yeah.
Thank you so much for sharing all of these incredible pearls of wisdom with us and for sharing your brother and for just being uh, awesome. I mean, I really appreciate you and I really appreciate your time. So thank you so very much.
No, thank you. I appreciate it.
Absolutely. And I'd like to thank everybody out there who's watching. I want to give a quick update. I don't recall if I gave it last week. We had an incident with our 10-month-old granddaughter, and she fell straight on her head off of a changing table the day before Labor Day weekend, the beginning of Labor Day weekend. And so we were in the ER. She fell straight on her head. Uh, the doctor gave a clear bill of health, but as a follow-up, we've had her for several days and she is completely back to normal. In fact, yesterday she learned how to say mama. And so that was really, really exciting for all of us. And she said, Dad, like the day before, she's starting to say words and she's just brings us so much joy. And we're so blessed and happy to just be a part of her life and our daughter and son-in-law's lives. And it's just been absolutely phenomenal. So I want to thank everybody for, I've had a lot of people reaching out and saying, hey, how is she? And so glad she's okay. And so that's kind of a follow-up. So I really appreciate it. And as far as this channel goes, please subscribe, like, and make a comment in the comments section. And I really appreciate all of you. And thank you for joining us. Thank you for watching and have a very incredible, blessed week. Thank you very much.
Thank you.
Oh boy, where? Oh, I gotta edit this. Where? Oh, here we go.